Hello and welcome to Med School. This is our last topic on iron deficiency anemia. In this, we are going to understand the progression of iron deficiency anemia, which is divided in three different stages: negative iron balance, iron deficient erythropoiesis, iron deficiency anemia. So, the first stage is negative iron balance, in which the demand for iron exceeds the body's ability to absorb the iron due to persistent loss of iron. Under these circumstances, the iron deficit is made up by mobilization of iron from the RE store. Now the iron is utilized from the stores like RE stores and marrow stores like bone marrow stores. So in this stage, the appearance of stainable iron in the bone marrow aspiration is decreased. So now see, what is happening is all the stores are depleted, but erythropoiesis is still going normal because erythroid cells are still getting iron. But the question is from where? See, the answer is, as we know, our serum iron has two forms of iron. One is transferrin iron, other one is serum ferritin iron. So transferrin iron is the iron our body usually uses. Transferrin iron is the only form which is useful, as all the cell has transferrin receptors by which the transferrin bound iron is traveling. Now we talk about serum ferritin. As 10% of iron is stored in the form of serum ferritin, and body is unable to utilize it as we don't have ferritin receptors like transferrin receptors. Now this is a desperate condition for our body to find iron. So our liver will produce more transferrin as to bind whatever iron form is available in the body. So what will happen is, as soon as the transferrin level increase, it binds to the serum ferritin and made iron available for erythropoiesis. So the important thing to understand here is serum ferritin decreases is the earliest laboratory changes we will notice in iron deficiency anemia. And there is no change in red cell morphology on peripheral blood smear, as there is no change in total serum iron. Now to understand total serum iron equal to bound iron plus serum ferritin. Now serum ferritin is decreasing and which is converting into the bound iron, and bound iron is increasing. So there is no change in total serum iron, and that is all for the first stage. Next stage is iron deficient erythropoiesis. So in this stage, all the body iron is depleted, and as the serum ferritin decreases, in turn the transferrin bound iron is also decreased. So what will happen is total serum iron is decreased. So as the serum iron reduces, which leads to iron deficient erythropoiesis, that means cytoplasmic maturation of RBC will start affected and hemoglobin production will also impaired. Now as we know, the hypochromic macrocytic RBC formation is started in iron deficient stage, but it will not reflect in the peripheral blood smear because it will take time to reflect in normal blood smear. So now the last stage is iron deficiency anemia. So in this stage, the hypochromic and macrocytic RBCs are seen more easily on the peripheral blood smear, and on the blood smear, target cell and misshapen red cell means poikilocytosis can be appreciated, and on the smear, cigar or pencil shaped forms can be seen. And in the last, there are three slides. First represent the stainable and non-stainable iron in bone marrow. Next two will represent the hypochromic macrocytic RBCs and target cell or misshapen cell and cigar or pencil shaped cells. So that's all for the stages of iron deficiency anemia. We will have to take a new lecture for treatment protocols and some PSM basics of iron deficiency anemia. Thank you, and please subscribe and like.